is your...
From MTN News, this is Montana This Morning.
I'm John Riley. The PACT Act, which hopes to address the needs of toxic exposed veterans, received bipartisan support and passed the Senate last night, is now headed to the president's desk.
I'm Jolisa Lee at Bozeman Health, where 28 people who held positions like managers, directors, and administrators were laid off. CEO John Hill tells us why and what's next. Coming up.
Well, it is 6:31 on this Thursday morning. Jane McDonald with Chet Lehman looking over a beautiful view, aren't we?
Absolutely. That's into the mining city. A little bit of haze in the sky over there, but temperatures are just absolutely beautiful. Take a look at what we're looking at here in southwest Montana right now. We're looking at unseasonably warm temperatures, actually. There's that hazy bank that you can see in the mining city, but temperatures right now in the mid 50s to some even low 60s out around southwest Montana. It's going to get warmer. Red flag warning still into effect, but we do have a cooling trend heading our direction. We'll have more on that coming up in just a few minutes.
Looking forward to it, Chet, as always. Well, Yellowstone National Park says it has a timeline for reopening alternate routes for flood-damaged roads in the northern part of the park. The Park Service says that a 4-mile temporary replacement road from Gardner to Mammoth will be paved and have 2 full lanes by October 15th. The new road will be open to all vehicles, and visitor access from the north entrance to Yellowstone will be restored. A long-term replacement plan for the old road, which was destroyed by flooding, continues. Estimates for that project reach as high as $1 billion. Further east, portions of road that were wiped out by flooding between Slough Creek and Barnett Meadows are also being restored. The park says those roads should be passable for general travel by October 15th. Those repairs are described as temporary as well, with long-term plans to replace the roads still underway. And Montana economists say after several years of rapid economic growth in the state, signs are pointing to changes. MTN's senior political reporter Jonathan Amberian has a detailed look at the mid-year economic update.
The University of Montana's Bureau of Business and Economic Research delivered an updated economic outlook in Helena on Wednesday morning. Their conclusions? The trends that have led to recent strong economic growth may be shifting.
The view out the rearview mirror is fantastic. What a great year it's been. What's ahead is what the problem is. That's what we're worried about. We don't see that as clearly.
BBER Director Patrick Barkey said the last year brought income gains in Montana, with employment and wage numbers at or above their pre-pandemic trends. However, he predicted much lower growth next year, as inflation begins to limit demand.
The ice for continuing even positive growth, let alone remarkable growth, is getting very thin for the national economy. The challenges are stacking up. We've had challenges of workforce, housing, inflation, and now we're having more challenges coming in from interest rates.
Barkey said Montana's economy is continuing to benefit from high rates of people moving in, but it's also maintaining pressure on the housing market. He pointed to data showing Gallatin County is still seeing more people move in than out, but people are now more likely to move to other Montana counties than to come in from elsewhere in the state. Also during Wednesday's event, University of Montana professor Simona Stan talked about the ongoing supply chain issues that have led to long waits for certain products. She said globalized supply chains have been positive for as long as demand has stayed predictable. That changed during the pandemic, especially as people turned to e-commerce.
We see a leveling of the situation, less congestion, shorter delivery times, so things getting slowly back to normal. Are they going to be back to normal like 2019 normal this year? No.
BBER is delivering this mid-year update in 7 Montana cities this week. They also visited Great Falls on Wednesday and will travel to Missoula and Kalispell on Thursday. In Helena, Jonathan Amberian, MTN News.
6:35 right now. One of Bozeman's largest employers, Bozeman Health, is laying off more than 24 employees, and some other job spots will not be filled right now. MTN's Jolisa Lee sat down with President and CEO of Bozeman Health to find out why.
Bozeman Health recently laid off 28 leadership staff and is eliminating 25 positions that were open. People that held these positions were managers, administrators, and directors. CEO John Hill tells us that this decision all came down to economic uncertainty, labor shortages, and preserving the jobs of healthcare professionals like nurses.
Those individuals that left Bozeman Health yesterday, those are our friends, colleagues. They've been incredible leaders, and their contributions have been extraordinary.
President and CEO John Hill said that the decision to let go of leadership staff was not performance related. He said rising healthcare costs, inflation, and labor shortages are impacting the healthcare system's revenue.
The economic crisis that we find ourselves in after the COVID pandemic has really stressed our entire organization.
After the pandemic, more and more healthcare professionals experienced burnout and decided to walk away for the sake of their own mental health. Bozeman Health began hiring temporary workers, which became a financial burden. Hill said in an email that costs this year have surpassed revenue by 8%, resulting in a loss of $2.5 million each month in the first 6 months of 2022. Bozeman Health's priority is now trying to retain frontline healthcare professionals, including doctors and nurses they already have, while recruiting more.
That difficult decision to not impact the front lines is why we went to the leadership roles.
Hill says that the leadership staff often serve as the hub of the wheel that keeps the healthcare industry rolling.
Their responsibilities were critical, and those areas of responsibility will be assumed by other leaders in the organization.
Hill said that the people who lost their jobs will get up to 6 months of severance pay, extended health care insurance, mental health support, unemployment pay, career placement services, and letters of recommendation. The decision was tough, according to Hill, but he says they have to be leaner about how they deliver care in the post-pandemic economy.
We have an obligation to support this community again, and so thinking about our cost structure, making sure health care is accessible and affordable for our community was at the very core of our decision.
In Bozeman, I'm Jolie Salee, MTN News.
Legislation to address health needs of veterans exposed to toxic chemicals during their service passed the Senate Tuesday night by a vote of 86 to 11. Both of Montana's senators voted in favor this go-around. MTN's John Riley breaks down what is in the bill.
The PACT Act, which received significant bipartisan support during its final passage after seeing opposition last week due to funding claims, is now headed to President Biden's desk, who's expected to sign it into law on Monday. Senator Jon Tester, who co-sponsored the bill, attributes the change in support to veterans and other citizens, letting senators know exactly how they feel on the matter.
When people make their voices heard in Washington, D.C., it can make a difference. And the veterans made their voices heard over the last week.
The PACT Act broadly addresses the health needs of toxic exposed veterans, but it also goes a bit further. Broken into 9 sections, the first 4 address health care coverage, expansion, and eligibility. It adds burn pit, additional Agent Orange, and other toxic exposure-related conditions to the VA's list of service presumptions. To get a VA disability rating, the disability must be connected to military service. For many health conditions, a vet needs to prove that their service caused the condition. This bill guarantees coverage for certain conditions. The PACT Act also creates a framework for the establishment of future presumptions, meaning the VA will be able to add conditions for coverage related to toxic exposure without an act of Congress, helping vets get coverage faster. Sections 5 and 6 establish research requirements and standards for health concerns related to toxic exposure through military service. And Sections 7 through 9 address VA resources such as medical facility leases, records updates and management, VA workforce recruitment and retention and funding for the programs. That funding came under scrutiny last week, with Republican senators saying they were voting against a procedural vote because they wanted $400 billion allocated set as discretionary funding rather than mandatory. Discretionary funding is what Congress decides each year to spend, while mandatory is guaranteed every year and takes legislation specifically addressing the funding to change it. Tester says mandatory funding is important in this case to provide stability for the new programs.
The mandatory is important because the funding is there. If you take away the funding, people are going to know it. You better have a good reason for it. And by the way, I'm not saying we shouldn't take away funding. We should take away funding, but this program should be allowed to work first. And then if it has more funding than it needs, then we can adjust it back.
Veterans can already begin the process of receiving new benefits covered by the PACT Act. They can go to va.gov/PACT or visit our website for more information. Reporting in Helena, John Riley, MTN News.
Senator Steve Daines and GOP leadership in the Montana State Legislature are pressuring Senator Jon Tester to vote against the Democrat-backed Inflation Reduction Act. In a letter Tuesday, Montana State Legislator Senate President Mark Blaisdell and Speaker of the House Wiley Gault asked the Montana congressional delegation to vote against the bill, writing, quote, "We need relief from President Biden's disastrous economic policy," unquote. Democrats need the whole caucus to pass the bill. As of yesterday, Tester hadn't decided whether he would vote in favor of the bill. Senate Democrats said that the bill is meant to fight inflation, reduce carbon emissions, and give Medicare the power to negotiate drug prices. The bill would also invest in the IRS, increasing audits for higher income taxpayers.
Montanans don't want to see the IRS supersized. That's the issue. This bill is a reckless tax and spending proposal. It's bad for Montana jobs. It's bad for made in Montana energy. It's bad for Montana's pocketbooks.
I have not told people I'm voting for it or against it at this moment in time because I want to look at the whole bill. There's $300 billion in debt pay down. That would be the biggest reduction in debt since I've been here in 15 years. Giving Medicare the ability to negotiate drugs, and I think that can help lower costs for folks.
Reports indicate lawmakers are expected to vote on the Inflation Reduction Act this week.